Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Professor Keisha Pollack-Porter, the Director of the Institute for Health and Social Policy at the Johns Hopkins Bloomberg School of Public Health. Our topic is her latest article, co-authored on the Health Affairs blog with Kathleen Murphy. It's entitled, Time for a Second Public Health Revolution, a Congressional Health Office to Score Federal Legislation. Let's listen. Dr. Pollack-Porter, thank you so much for joining me. You have just co-authored this very interesting piece in Health Affairs called Time for a Second Public Health Revolution, a Congressional Office to Score Federal Legislation. Tell me about this idea.
Thanks for having me, Josh. I really appreciate it. So the idea behind the piece in Health Affairs is that it's time to do things differently in this country. And what we talked about in this blog post is, can we elevate considerations around health and equity during the federal policymaking process?
Hold on one second. Do you mean to say that health is not at the center of the federal policymaking process, Dr.
Surprise, surprise. Yes. As much as people may find that hard to believe. I've been working in the area of what we consider health in all policies for a long time, where I've been helping policymakers, decision makers, think about how their decisions in other sectors connect with health. And so much of what I've struggled with over the years is health has been narrowly defined around healthcare. And so it's really been helping policymakers figure out and learn what public health people have known forever, which is that decisions in sectors such as housing, education, transportation, et cetera, affect health. And so that's the thought behind this idea.
So in other words, people might naturally say, if we're making this change to Medicare, is that going to have a benefit for health? But
absolutely.
But they might not naturally think about that if it's a change to housing policy or transportation policy.
Exactly.
Now, what would you say if someone said, but that's housing or transportation policy, that's not health policy, so why should we care about health in that context?
I would say that's a really fair question. And yes, and it's health policy as well, because we know, let's take housing, for example. We know the importance of having affordable and safe housing for health. We know that individuals who have a place to live and that stability from that has significant benefits for health outcomes. We know that housing is a determinant of health. So if we know all that, then we should also believe that decisions that are made by our colleagues in the housing sector can negatively affect health just as much as positively affect health. So what we want to do is say, let's think about this before we sign that, before that bill gets voted on and becomes a law. Let's think about how this issue could affect health, because we don't do it in a systematic way.
In other words, let's say there were legislation maybe on green standards for health. There might be an opportunity to look at whether those green standards would actually make people who live there healthy.
Absolutely. And because I think even at times somebody might say, well, what about those, those standards aren't health, but if they impact health, let's take a look at how they could improve health, how they could harm health. And also we think that there's an opportunity to also talk about the connections with equity. So this idea that we put forward in this blog to score legislation is really around, let's score for health. Let's score for health. Let's score for health equity.
So give me an example of how that would work.
One example is the Farm Bill. All right, so let's think about, and I think the Farm Bill is a great example. All right, it's this omnibus law. It's huge. It has so many aspects of it. And if we think about the commodity subsidy, that part, right? So think about commodity subsidy for crops, right? Corn, wheat, et cetera, rice. So this subsidy was initially meant to incentivize farmers to plant these crops way back during the Great Depression, right? As a way to alleviate hunger. And so here you have this aspect of the Farm Bill that was supposed to help people and help address hunger. And over time, though, this subsidy has had some very harmful and unintended consequences for health. We know that commodity crops, corn, rice, the things I just mentioned, are really core ingredients for processed foods. And so by subsidizing these crops, it really incentivized their production over fruits and vegetables. So this food ends up being cheaper. So I provide that background to say, if we had a process where we could score that bill for health, we would elevate and illuminate how doing that might promote consumption of junk food over nutritious food. Just think about if that bill had been looked at through a public health lens, we could have seen the potential impact of these subsidies on health in a negative way. So that bill was scored for its cost, like through the CBO, through the Congressional Budget Office. So what we're saying is we need a Congressional Health Office to be able to provide a health score.
Right. Legislation, before it gets voted on, the Budget Office analyzes it, produces a report, and that report informs members of Congress about the legislation before they decide what to do. You're saying there should be a health office that does a similar kind of report, but instead of looking at the impact on the budget, you're looking at the impact on the health of the American people.
Exactly. So similar to a health score, similar to a CBO score, Congressional Budget Office score, that's objective and credible. What if there was a health score? What if there was a way to say, we're going to score this bill on the potential health impacts and provide that information to Congress so they can look at that alongside what they're seeing come out of the CBO.
Right. So when you say score, you're talking about a number?
That's the challenge. I think for simplicity, it would be great to have a number. But I think this is where, we put out this idea and now the question is, well, how do you make it happen? And I will admit this is hard. Like, I acknowledge that there are challenges. And so my co-author on the paper, Kathy Murphy, she's also a part-time MPH student here at Hopkins. And for her capstone, she's been talking to people about how could we make this work? Like, what would need to happen here? And so I'm looking forward to hearing what she learns through her interviews. But some people say a score would be great, but how do you do it? Where do you get the data from? Who does it? So there's lots of things to unpack before we can even move this idea to a reality.
But just conceptually, let's say you get over that hump and you have a score, that would be like another report that goes to Congress. It wouldn't force them to either support or vote down a piece of legislation. It would just be information to the legislative process. Is that right?
Absolutely. So it's one additional piece of information that I hope they would consider. And I suspect as part of educating lawmakers, educating them on this new office, the type of attention I suspect an office like this would get, they would see it as an additional piece of information and understand what they're getting. So you want it to be simple and understandable. And I think there's potential there. And so we want to unpack this and figure out if there's a way that we can make this happen.
Yeah, I mean, the way that it works for Congressional Budget Office scores is that members of Congress will submit their legislation and see what the score is, and then they might change the legislation to get a better score. So you could imagine if you've got like a -10 score or whatever it is for health, and people go like, oh, I don't want to introduce a bill with a -10 score. And then maybe they'd say, well, it looks like we lost points here and we lost points here. I'm going to revise the bill and try to get another score before I move it forward.
If there was a way to do that, I think we would see so many improvements in terms of the types of legislation that comes out of Congress. So if we can think about doing exactly what you just said, Josh, think about assessing a policy's impact on population health, on well-being, on equity with some number, let's say, somebody could go back and say, you know what, we should change this because these potential harms, these estimated harms are so great. They're going to contribute to inequities. They're going to lead to costly health conditions down the road. Let's change that. Let's amend this bill in order to reduce those potential harms to health, and even in a way to improve health.
Right. And ideally, you'd have the members of Congress themselves excited to do that.
Absolutely.
So one of the challenges is coming up with the way to actually turn this into a numerical score, which I'm hearing you say is not just about the overall impact on health, but also making sure that people who are particularly challenged communities with particularly heavy burdens of disease are taken into account in how the legislation is done. And it's about equity as well.
Ideally, yes, that's absolutely right. And my vision for this and Kathy's vision for this score is that it would highlight those potential impacts on health, and also look at how certain communities could be disproportionately impacted by that, what would happen in terms of if that bill was signed into law. And I think it's really an important way to sort of get us to help realize what we're hearing people calling for in this country in terms of racial equity, thinking about health equity. And so we think that this is really bold action that warrants some consideration.
So criminal justice legislation?
Yes, it's a great example. And you can imagine when a bill comes forward that you could score this bill the same way CBO would score for the economic impacts. You could also look and see what the health impacts would be of a bill related to criminal justice, or anything else, the environment, bill related to things that might not seem so clearly to connect health, right? I think that's the power of this kind of analysis.
So let me ask you about a challenge of a different kind that comes to mind, which is that a lot of time what's driving legislation in these different areas really has nothing to do with health. And the people, maybe the interests that are behind it, really aren't that interested in knowing the health impact. So someone might say about the Farm Bill that, well, there's a reason now why we continue to subsidize corn is that there are manufacturers that make things out of that would, have to raise their prices, and where they'd sell fewer, different kinds of sodas or whatever it is, because of the benefit they get from the legislation. So, it's just not going to help to be saying, why don't you do a health analysis? Because this is not being driven by a perspective about health at all. And so my question is, how do you overcome kind of the core political obstacles that are there in trying to get people to pay more attention to the health impact that legislation has?
I will tell you, Josh, this is something I spend a lot of time doing now. Part of the motivation for this paper is work that I've been doing with colleagues at the Pew Charitable Trust involving something called a health note. And we've been trying to score bills at the state level, bills that are coming out of non-health committees, just to really sort of pilot this idea. And we're expanding it and actually working on one right now with Washington, D.C., with the City Council. And one of the things I've learned is how much time it takes to even get to educate these elected officials around how this bill matters for health and why they should care about it, as well as the stakeholders. So one example is, I work a lot with individuals in transportation. And so again, very clear, these are transportation outcomes. Like, why should I care about health? It's really part of my argument has been, well, if we can advance health goals, there are both sides can benefit from this, right? There are benefits to transportation if we think about health. There are benefits to both systems. And so really trying to think about what are those mutually beneficial areas, think about efficiencies of resources, but it's really, it takes a lot of time, a lot of advocacy, a lot of education. And that's what we've had to do at states to even get them to think about or even to pilot this health note idea. So I think we'll have to do the same thing at the federal level.
Right.
But you're absolutely right. I mean, the politics here are huge. And, I think there's some movement with Representative Cox's bill that he introduced over the summer, the AHEAD Act, the Assimilating Health and Equity Assessments into Decision-Making. Mm-hmm. It's calling on the National Academies of Science, Engineering, and Medicine to study different tools and how they could be incorporated into the federal legislation process. So I hope that moves forward. And if so, if we can get NASEM to study tools and to see what the potential is, that might help garner some more support.
And it sounds like what you're saying is that an office, congressional health office, to score legislation would be one piece of the puzzle. But you'd probably also need to have a political effort to get people to pay attention to it, and to, maybe establish an expectation that people at least are going to get a score and they're going to pay attention to a score, even if there's some interests coming in that may want to push forward legislation that, isn't so great for health. You would be able to at least have the health note, and then people who are fighting for health could, maybe outside the health office is just doing its sort of narrow job of just telling the facts about health. You'd have like the opportunity for other political forces to come in and engage.
Absolutely. I don't at all believe if we build it, they will come, right? So we have to, building this office, having this assessment, the ability to have the assessment done on legislation is certainly one aspect. We have to also then help people understand what it is they're getting, help people understand how to interpret what that score would look like, and also think about, well, what do you do with this information, right? So getting it to Congress is one aspect. But certainly, it's the and here, getting it to public health advocates or other individuals who care about health is another piece. So there's certainly multiple components of this, but we really see getting this office, which in and of itself is very political, right? For people who think government's too big. So the thought of having another office, I think people are already resistant to that. But even if there's a space to put it in Health and Human Services or something, I think finding out where this new unit could go is also interesting. But once we have it, we have to also invest time and effort to making sure people understand what they're getting, how we can use the information, and making sure advocates can also access it. So they need to be publicly available, just like you can download a CBO report on the website. We would imagine being able to do that, where people could go into offices and say, hey, this has a really bad score for health. We need to think about, if it's going to go forward as is, or can it be amended? Like, I think there's great power in terms of public health advocacy with the potential for the additional data that could come from this analysis.
Great. Well, thank you so much for explaining this to me today. I really appreciate it. And good luck bringing this idea that you put out with your co-author into reality.
Great. Thank you for having me. I hope to come back in the future when things have moved forward and there is an office, and I can tell you how it's going.
Sounds good. Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.